Suzanne Campbell here from Wellness Embodied in Cairns. Today we're just going to give you a quick rundown of the top 4 reasons why we see that people don't recover from their back pain. So number 1 is they don't treat the nervous system, or their clinician doesn't treat the nervous system. Here at Wellness Embodied, we're really passionate about looking at the nerves and the nervous system as an actual source of pain. So we will test and treat for nerve sensitization, mechanosensitivity, whatever you want to call it. That's really different from having a compressed or a pinched nerve. Comment below, ask us any questions if you want to know more about that. We talk about it a lot and we've written a lot of things about it. Campbell?
I also think number 2, or another big factor, is sometimes reintroducing the stimulus that we know is going to be aggravating to the spine a little bit too soon. So patients that come in, they get a little bit of improvement and then they jump back into the gym or whatever activity might be a bit provoking for the back. We really need to think about the back as a long term. It needs a bit more time of recovery. There's nothing wrong with reintroducing the aggravating stimulus or what that may be, but it's at the right time frame as the recovery progresses.
Yeah. The third thing is just not actually doing enough rehab. So, I mean, we all want to have a quick fix. It'd be really awesome if we could just take a pill and, be able to run a marathon or whatever. But I guess using that analogy of the marathon, you don't just go for one training session and go and run a marathon the next day. So similar with treating and rehabilitating your back, you can come in for one treatment and you can feel amazing, but if you don't actually correct a lot of those muscle imbalances, soft tissue shortening, and a lot of the things that are actually causing your problem, it's just not going to work long term. So we offer the rehab room here at Wellness Embodied to help keep you accountable with that, which is basically a physio-led space where you come in and do your rehab exercises, and we progress them with you, correct any things that you're doing wrong. And even after those 5 sessions, we really notice a huge difference, or our clients really notice a huge difference in their pain and strength.
And I think the last, and definitely not the least important, the 4th, is your belief system around back pain. A lot of what the research coming out today is about the emotional component, the psychological component of back pain. It's less about what's just happening at the tissue and really about your entire state. So if you're thinking the pain's going to be bad, if you think it's going to be there forever, that does play a big component in what you're going to feel and basically the sensations that you're going to take. So a lot of what we treat, as well as educating the patient, educating you on why your back's sore, what to do when it hurts, and the reasons behind that pain, so that it's not this catastrophizing fear, I'm not allowed to move because it's going to hurt. We just sort of chip away at that so you know what's good and what's bad, and that helps you understand what's going on at your back.
Awesome. So I'd love you guys to check out our Don't Look Back program as well. I'll post some links to that in the comments. Again, any questions, concerns, anything you have on this video, please comment below, share, we'd love to hear from you. Thanks guys.
Bye.